who are not able to join, who have asked for the recording.
Yeah. So, okay. So it's 6:05. I think we will get started. Good evening, everyone. Elrigu namaskara. Namaste. My name is Rotarian Kashinath Prabhu, President of Rotary Bangalore Lakeside, and I'll be the co-host of this evening, along with Rotarian Abhilasha Pandit, Club Secretary of Rotary Bangalore Lakeside. With permission, we'll start the proceeding now. As we have the main process at Rotary, right? It's a Rotary meeting, so we'll call the meeting to the order. So on behalf of Rotary Bangalore Lakeside and Beautiful Bengaluru, earlier known as Beautiful Bengaluru and now Beautiful Bharat, it gives me immense pleasure to welcome you all to a special webinar, Address Public Spitting, NTB Save Lives, on the occasion of World TB Day, the focus area of disease prevention. World TB Day is observed on March 24 each year to raise public awareness and understanding about one of the world's deadliest killer disease, TB, and its devastating health, social, and economic impact on people around the world. The theme for this year, Invest to End TB, Save Lives, to convey the urgent need to invest resources to ramp up the fight against TB and achieve the commitments to end TB made by global leaders. This is especially critical in the context of COVID-19 pandemic that has put end to TB progress. I would like to welcome and acknowledge the presence of our today's eminent panelist, Dr. Kunal Sharma, SRL Diagnostic member of COVID consultative group. Welcome, Doctor. Dr. Prarthana BS, strategic lead, TB Karnataka Health Promotion Trust. Welcome, ma'am. Odette, co-founder, Beautiful Bharat, championing the Stop India Spitting movement. Welcome, Odette. Our moderator for today's panel discussion, Rotarian Jayaraman sir, Director, Disease Prevention and Treatment, RID District 3190. I would also like to welcome and acknowledge the presence of Rotarians here, fellow members, friends in Rotary, friends of Rotary, and community friends. Thank you all for joining us this evening, and have a nice time. Enjoy the rest of the session. So we now move on to the next session. We are fortunate to have an eminent list of panelists on today's topic. Each one of them have done so much to the society and have will bring in different insight and perspective on today's topic. I now request my co-host, Rotarian Abhilasha Pandit, to do a brief introduction of each panelist.
Thank you, Kashi. Can you hear me?
Yeah.
Okay. Ellarigu namaskara. Welcome everyone to this special webinar on Address Public Spitting, End TB, Save Lives on World TB Day. Rotary Bangalore Lakeside is proud to support Stop India Spitting campaign. It is my pleasure and honor to introduce the panelists for the webinar. Let me begin by introducing first Dr. Kunal Sharma, who is Head of Histopathology and Center of Excellence at SRL Diagnostics. He is also a member of COVID consultative group, as well as a medical advisor to the government of Karnataka. He has been a keynote speaker at various national and international conferences with publications in journals like Archives of Pathology and American Journal of Hematology. He has been instrumental in key policy decisions around COVID testing in Karnataka. He is bestowed with numerous recognitions, including State Welfare Icon of the Year Award by Healthwire Media and HDFC Neighborhood Hero Award. Welcome, Dr. Kunal Sharma. Second is Dr. Prarthana BS, a medical doctor trained in public health, medical law, and ethics, as well as in family medicine. She has over 15 years of clinical and public health experience covering grassroots and state levels. She has worked as a clinician in HIV, STIs, and family medicine. She also has worked as a technical and training coordinator in various projects across themes of HIV, MNCH, and tuberculosis since 2010. Currently, she is the strategic lead for tuberculosis in KHPT, providing inputs to various projects in TB theme in KHPT, covering private sector engagement, community engagement, and patient care. She is interested in integrating health with development across sectors. Welcome, Dr. Prarthana. Odette, ma'am. Sorry, Odette. Odette is co-founder Beautiful Bharat, earlier known as Beautiful Bangalore, a volunteer group working on cleanup public spaces, environment, and sustainability. She is a behavior change professional with 30 plus years experience, with last 10 years focused on social change with several successful mass interventions to her credit. She is driving the national Stop India Spitting movement, using her expertise to bring impactful change, complex strategy involving many different stakeholders. She is convinced we can make COVID a turning point for public spitting in India. And this is her current priority, to build the movement that can impact spitting in public spaces. Welcome, Odette, ma'am. Last but not the least, can I say, Rotarian Jayaraman, sir. Nayan Jyoti Trust is the brainchild of Rotarian Jayaraman, sir, an engineering graduate in electronics and communication, a vibrant personality who was on the corporate ladder in the IT industry as a facilitator, India operations at Gandiva Infotech Private Limited, and as a director operations at Stream Processors India. He is a dedicated Rotarian in his home club, Rotary Bangalore Lakeside, committed to socially relevant projects where his compassion, skills of management, technical creativity, and communications are utilized. Rotarian Jayaraman sir was a consultant to the Azim Premji Foundation and a fundraiser for Accha Patra. He is involved as trustee with Sri Ramana Free Clinic Trust, International Children's Peace Council, IPDP, Vishranti Trust, and actively connected with many service organizations. He is ably supported by his family on his socially relevant initiatives. In the current Rotary year, which is 2021-22, he is Director, Disease Prevention and Treatment for Rotary District 3190. Welcome, Rotarian Jayaraman, sir.
Thank you.
Thank you. Over to you, Kashi.
Thank you. Thank you, Abhilasha, for the brief introduction of the panelist. It's now time to get into the main topic of today's panel discussion. I would request Rotarian Jayaraman sir to take over the session. Yeah.
Thanks, Kashi. Thanks, Abhilasha, for that introductions. And greetings from myself, Rotarian Jayaraman. I am the Director for Disease Prevention and Treatment in Rotary. Those people who are non-Rotarians, the Rotary is a 1.4 million group of neighbors and friends and other people who are all joined together to bring the change in lives of people. And there are about 46,000 clubs all over India focusing on disease prevention, literacy, economic development, and many other things. If we all get a chance to get involved in Rotary, please do that. Now, today, the webinar is aimed at bringing very specifically reconnecting to Stop India Spitting on the occasion of World TB Day, and also connect the role of spitting in TB disease spread. When I thought about this, when we talk about prevention of disease in most of the cases, to my mind, it comes that the responsibility lies on the individual, in the sense that if I have to prevent myself from diabetes or something, I have to do the basic health lifestyle and all those things. But in TB, for me, it looks like to stop spreading the disease becomes a key action in the prevention. This means making people understand what are the symptoms and all these things. They try to take early understanding of it, seek treatment, and not to become the spreader of the disease unknowingly. So it brings us to the point, symptoms and other things about TB has to be understood, and we have an excellent set of people who are going to talk about it. I would like to invite Dr. Kunal Sharma with a question. Dr. Kunal, what is the significance of this World TB Day and is important for India?
So, sir, for everybody, World TB Day is actually it's 24th of March. That is today, and this is the day when the tubercle bacilli was first discovered by Robert Koch in 1882. So this is a reminder to us about the menace that this disease has been causing And that we really need to ramp up our facilities and our management to make sure that we get rid of this menace, because it's one of the most underestimated diseases, especially with the advent of COVID. A lot of focus has shifted to COVID, and over the tuberculosis management programs across the globe, they have really taken a hit. So this is actually the significance of World Tuberculosis Day, because and especially in the Indian context, we must remember that India is the TB capital of the world. We have the maximum number of cases in the world, and we still have exceedingly large number of multi-drug resistant, and XDR TB cases. So this is something that is very, very relevant to a country like us with this size of a population, and where our sense of hygiene hasn't really reached a level, where we can think of a complete eradication of tuberculosis.
Maybe the next question will be that you said the numbers are large. Can you throw some numbers, what is the kind of numbers in India, and then why it is so prevalent in India?
So right now we have about 26 lakhs cases. This is almost 1 to 2 lakhs less over the last 2-3 years. The number is really high in India. One is because for the tubercle bacilli to grow, the environment in India is very favorable. And the other thing is that because of the population and the density of population in our country, the spread happens very rapidly. Also because, I have to accept it today that our sense of hygiene and our sense of safe practices, they are not exactly up to the mark. So when you put all of these things together, this forms an absolute, breeding ground for a disease like tuberculosis.
So I see every year. Sorry, please go ahead. Sorry.
Statistics I would like to tell you that unlike what is thought, tuberculosis is more of a disease of the urban India rather than the rural India. And there also, if you see, North India is the zone where it is most prevalent, and South India is the zone where it is least prevalent. So I definitely ascribe a role of education and basic sense of hygiene to the incidence and prevalence of TB.
Coming back to this World Days, they always bring a theme into it. I think this year, I think the theme for Tuberculosis Day is Invest to End TB, Save Lives. What do you infer from that?
So the reason why the World Health, why the theme has been this for this World TB Day is because, of late, because of COVID, a lot of attention has been diverted. There, our TB control programs have taken a hit globally. So now it is a very, very important time for us to remind ourselves that we need to ramp up the facilities for management, which include diagnosis of tuberculosis, especially in cases of, as I told you, the number of cases of MDR TB are rising in India. A very important point to understand is that although the fatality rate, although the cure rate of MDR TB is also rising, okay, but still the fatality rate is rising because overall number of MDR TB cases are rising much more than the cure rate. I hope I'm making it clear. The cure rates of MDR TB are on a higher, right? But still the fatality rate of MDR TB is much higher because the total number of cases of drug-resistant tuberculosis are very high. So it's very important for us to figure out which of these drug-resistant TB cases exist and to figure them out early, because when these transmit, they create havoc. And all the first line of treatments, it fails for these drug-resistant tuberculosis cases.
So that brings to the important point that, for a common man to understand where he should start looking into going for a screening or diagnostic or anything like that, what is the symptoms he should look for?
So, if you have a very common symptom is cough. If you have cough that lasts for more than 3 weeks and it is unexplained, plus if you have, vague symptoms like evening rise of temperature, if there is blood that is coming in your sputum, if there is breathlessness that you're facing, if there is chest pain that you're facing, or if there are, these are the signs of pulmonary tuberculosis. But we need to understand that tuberculosis can involve a lot of other systems in the body. There can be gastrointestinal tuberculosis, there can be genitourinary tuberculosis, there can be lymph nodal involvement in tuberculosis. So if you have a lymph nodal mass in the neck, these are the kind of signs and symptoms that must alert you that you need to definitely go on for further investigation to rule out tuberculosis. Or if you have a contact history with a known tuberculosis patient, and you experience any of these symptoms, again, then you need to go for investigation.
I could see from the earlier discussions, casual discussions we were having, you are a fan of Odette on our Stop India Spitting. How do you consider spitting as a part of spreading TB?
You see, in India especially, this is a very big problem. I mean, it is a representation of a lot of factors. Not only does, so as we all know that tuberculosis is airborne, and spitting releases all that right into the environment. Plus, what it also does is the tubercle bacilli can stay in the air for a very long time. So when you spit it out, you are actually making people around you very, very, at a high risk of encountering tuberculosis. So spitting definitely is a very big menace and it needs to be controlled. What spitting also does is that it is a reflection of the oral hygiene that the person must be carrying. And, hygiene has a very, very, very close relation with the spreading of tuberculosis. Smoking, as we know, has a very, it is a risk factor for tuberculosis. And you will see that people who chew tobacco or smoke, these are the people who also are the ones who spit most commonly. So there is, it's a surrogate marker also, and it is a direct positive factor as far as tuberculosis is concerned.
Thanks, Dr. Kunal. I will come back to you, but because you have built a good case for Odette to now come into the picture. Odette, now having said that the spitting is going to be one of those things which could spread, what could we, just tell us about your movement and your aims and the strategies for Stop India Spitting. You're muted.
Yes.
Please.
So you see this open dead end right next to me. It leads to a slum. And on March 16th, 2 years back, when we were first being told the COVID preventive measures, there was I lathering my hands for that 20 seconds. And I happened to look out and I saw a man spitting. And that's when it hit me that we are taking so much care on prevention with mask, distancing, hand hygiene. And spitting is here, undiluted aerosols are going, and why is nothing being done? And that was the same day that through Beautiful Bangalore, as we were known then, we took out the petition which went viral and spitting became punishable. As a result of that, on 15th of April, we also asked the PM that he must talk about spitting in public places and the danger it puts people to, and that happened on 26th of April when he spoke about it in Man Ki Baat, which is listened in every corner of the country. People who don't have TVs, they listen on their radio. So I think this kind of powerful message needed to get to every corner, which it happened then. Unfortunately, after that, the government has not followed through. Even COVID preventive lists simply still continued to say mask distancing, hand hygiene. The irony is you see people on the street wearing a mask to keep away COVID, lift it, spit, put it back, which clearly tells you they don't get the link with saliva and COVID. And we can't blame them because our government wasn't stressing on it. In Karnataka, we managed to add in it as a fourth point, and therefore we had a lot of, drives and all. However, across the country, this wasn't happening. So the movement began through groups who all agreed that, hey, spitting is spreading disease, spitting needs to stop. So we have a group today, which is almost 100 partners across the country, educational institutes. We have someone from Calcutta here today who represents a school. We have somebody from Kerala from the health department. Thane Municipal Department is also part of it. So we have lots and lots of different people, hospitals, organizations, RWAs, NGOs, who all feel, yes, this is something important. The strategy simply, Mr. Jayaraman, to answer your question is, it is not only to tell those who spit that they should stop spitting. Who will tell them to stop spitting? Because those who don't spit, they don't like the subject. And as I tell people in my WhatsApp chats, when they say, "Arey, you and your spitting, why do you keep talking about these dirty things?" And I say, if the subject is too dirty for our conversations and our WhatsApp chats, how do you expect our streets will get clean magically? Kasi, can I share my screen and show a poster? Yeah, I just want to show you a poster, cartoon. This cartoon is...
Yeah.
Yeah, so if you look at this cartoon on the left side and on the right side, This cartoon is created by Suresh, one of our Beautiful Bangalore team who draws beautifully. The left side is different from the right side. So does anybody want to tell me what's the difference? The set on the left is doing something and the set on the right is doing something else. Anyone wants to?
Right is stopping.
Yeah.
I mean, right is telling don't do.
The people on the left are just pretending not to see it.
Yeah.
Yeah. So this, it's visible in this poster, which says a strong point: bystander response matters. Because if a guy is spitting on the street, and literally that's why people continue to spit, if we all keep quiet. So if a guy is spitting on the street and 10 people don't tell him anything, why on earth will he stop spitting? We need 10 people to tell him, Ugi bedi, thukna nahi, roga felte hai, whatever, in different languages. So we need people to respond. Our government is not putting out signs saying no spitting, and we are now pushing for it through a petition. Like you have no parking, no honking, no smoking, why not no spitting? Because as life goes back to normal after the third wave, we have to make people realize spitting in public is no longer acceptable. So the first part of the strategy is, to those who spit, we are asking them, no spitting, please. Spitting spreads disease. But who will tell them? So the other part of our target audience to those who don't spit is, hey, don't turn the other way. Please speak up. Please help us have conversations that can drive the slow transformation on the ground.
Wonderful. I think now I would like to bring in Dr. Prarthana. Prarthana, you must have heard two strong people going against spitting, though you said today morning the meeting in Delhi didn't talk about spitting at this point of time for TB, towards handling TB. So I just want to bring in you to tell that you are working with the poor and needy people who are all on the, the migrants and the people who are working with the Metro Rail or wherever it is. And you have been working with them seriously on that. So what is the burden of TB as for Karnataka, specifically with Bangalore is concerned?
Yeah, so specifically with respect to Bangalore, we had around 20,000 plus cases in Bangalore, which was in 2019, 20,000 plus cases. But of course, in 2020 and 2021 numbers haven't come out, but 2020, there was a drop of around 30% or so because of COVID, of course. And 2021, they did pick up, but I don't think we've reached the 2019 level still. So having said that, the target or the expected number of cases in Bangalore is almost double, considering the size of the city, size of the metro with 1.25 crore population and all of those things. The estimated cases of tuberculosis is much higher. We are not sure whether we are actually missing people or whether the estimates are higher, but ultimately there is a mismatch in the estimated numbers and the numbers that are actually coming out. And where we are working with the vulnerable population, predominantly urban slums, because ultimately all the migrants, every other construction worker ends up in the urban slums. But we do work also with specific unions which are working with construction workers and so on. The presence of tuberculosis in these migrants is much higher, though it has been lower than what has been expected in Bangalore per se. But overall, when we go to Bihar, we're also working in Bihar, for example, with migrants. There we find that the cases are higher. So like Dr. Kunal already mentioned, there is a lot of gap between, there's a lot of geographical variations in the way TB is actually occurring within the country as well. And when it comes to, today actually there was a national prevalence survey released, which is basically trying to say that for every case which we have notified of tuberculosis, there are 2.48 missed. So now we are not sure. I mean, this is a new report which has come out. We still have to go back, analyze it, find out the geographical variation, make district level assumptions, identify what each district is showing up and so on. But the bottom line is that there is a burden of disease. So we are talking about 4.4 lakh deaths every year. And this has stayed for a very long time the same number. Even amongst persons whom we have diagnosed, whom the country has diagnosed and is on follow-up, the death rate or the mortality rate has not come below 6% ever. So it is between 6 and 7% all the time. And this I'm talking about drug sensitive TB. I'm not even going to the drug resistant TB, which Dr. Kunal mentioned, where the mortality, the deaths are much higher. So this is the actual burden, not only of the disease, but it is a huge thing, because people go to multiple areas to get diagnosed, which means it is directly affecting, it is increasing the cost of the healthcare as well. So it is not just the burden of disease in terms of the suffering because of TB alone. It is also the amount of energy, time, money spent from each individual families before a TB person is diagnosed with TB.
Right. In fact,
Mr. Jayaraman, can I just add one point to what Doctor talked of the 4.4 lakh per annum deaths due to TB every year. The whole world, the whole country came to a standstill because of COVID. In perspective, not to downplay COVID, but in 2 years, COVID has killed around 5.16 lakh people in 2 years. COVID kills TB kills 4.4 lakh every year, but there's no fuss about it, largely because I tend to think that it's seen as a poor man's disease, and therefore the seriousness hasn't got through. Whereas if you look at mortality, I think COVID is 1.17 versus TB, which is 17%. And I think World TB Day is a huge reason to focus that TB is also serious. It's not that, yes, COVID was something which brought the world to a standstill, but our reaction has to be equally, what should I say, sincere and diligent, that TB. And I think all those present here today can help put this in perspective in communities, in talks that we keep giving.
Wonderful.
I agree actually. And just to add to what you're saying, I think the other reason, one important reason why TB nobody else seems to make a fuss about TB is also because at the back, there's a lot of hidden stigma. I like to call it latent stigma, because I tend to think that one, TB is a poor man's disease, and two, it is an age-old disease. It was there when my grandparents had, my great-grandparents had. It is not there now because India is supposedly moving towards becoming a developed country and less towards a developing country, though all of us know that there is a huge gap. There are two Indias. But in spite of it, TB occurs, Bangalore again as an example, because we were working with players like Apollo hospitals and other corporate hospitals like Fortis and Manipals and so on. The number of patients or people diagnosed with tuberculosis who go to these corporate hospitals is huge. We wouldn't expect it when we think of TB as a poor man's disease. If we actually look at these, and it is not that it is a person from the slum who is going to these places because they cannot get diagnosed anywhere. It is really people who are well off. So it is everybody's disease itself.
I need to add here that 30 years ago, when I first started working, I went to Delhi and I used to travel by buses and walk in the filthiest of places because in crowded places, I ended up with pleurisy. I got treated for an entire year. I was hospitalized, which is, I think, a form of tuberculosis. And for 3 full years, I could not take a deep breath, that feeling. So what I'm saying is, yes, prevention is so important. And I didn't know at that time about cough etiquette, which I request the doctors can throw light on. Spitting, of course, but I would have, I think, been a little more careful of, and I think that's Mr. Jayaraman's next question of how can we prevent ourselves from catching TB from those around, which is...
Yeah, I just just before that, I would like to ask, because today morning, Prarthana was in the national program. What is the structure of the national program, and what are the activities they will do this year coming up, as for the TB is concerned?
The national program is a vertical program, and now, like I mentioned, it is moving more towards decentralization and merging with the health and wellness care centers, which is the which is going to be the most it is going to be the point of contact, especially for the rural areas, and it is a holistic center. It is envisioned as a holistic center, which is a prevention. Where prevention is a huge component. It was not so till now. All the other health centers have predominantly concentrated on curative services and diagnostic services till now. though in theory, there was a little talk of prevention, but currently the Health and Wellness Center is very clearly envisioned as also a preventive center. So that is also the place that TB services will slowly be moving towards. And this is for the, predominantly it will benefit the rural population. How it is going to pan out in the urban populations is yet to, we're yet to figure it out. That is the first thing. The second thing is also involving, again, for the rural populations, the self-help, self-governments like the Panchayati Raj institutions in TB care. Currently, TB is been the baby, all TB programs, everything has been the baby of a central TB division, which is a vertical program under the National Health Mission. So it is not connected to any other programs. It is not connected to any other, multi-sectoral engagement is there only on paper. It is not real. There is no strong connect. We know it occurs more with, like Dr. Kunal mentioned, with people with tobacco use. But the linkage between the TB and the tobacco cessation activities are minimal. We know it occurs more when there is alcohol use. Linkage between de-addiction services and or even screening amongst alcoholics for TB is very minimal. We know that it occurs under malnourished. Linkage with Food and Civil Supplies Department is minimal. So it's a very vertical program. Hopefully this year that shift will start happening. But then there were also a lot of technical changes. Like I mentioned, some newer diagnostics which may be coming out this year, and the treatment regimens are almost standardized. There's no change in the treatment regimens. One of the most important things that has come out, which has relevance to our topic today, what we're discussing now, is about the prevention of TB. Now, because we all know it's an airborne disease, and because there's a droplet infection which happens, and it is most commonly happening it is like there is a direct proportional relationship between the exposure, the duration of exposure to a person who is coughing or spitting or sneezing, and the other person actually catching the disease. Basically, the spread from one non-infected person to an infected person is directly dependent on the duration of exposure and the severity of the exposure, both. So if I'm coughing more and I'm having TB, then it is most likely that my husband, my kids, who are inside my house are the first people to get it, just like with COVID. The biggest difference which will, which is kind of impeding all our preventive efforts is this, that in COVID, to use the same, because all of us seem to know lots about COVID, the symptoms are seen immediately. Like I got COVID, then my husband's symptoms are seen within the next 2 weeks. My kids' symptoms are seen within the next week. But unfortunately for us, and fortunately for TB goes and hides inside my husband. It doesn't come out soon, which means he's just having a latent infection, and it is never going to show up as a disease at all. And it will show up whenever TB feels like it. It may be 2 years, it may be sometimes up to 5 years as well. There, the prevention becomes very difficult. The Central TB Division and the national programs have actually taken up prevention in this group of people, the household contacts currently. But coming back to the whole concept of cough hygiene, in paper, it has always been there. The last 10, 12 years at least, it has been there on paper for patients. But then again, I remember, even today, I remember there was a 60-plus-year-old person who was having a real difficult time. Like you mentioned, Ms. Odette, that the cough and that pain which he was having while breathing, very pitiful sight. And all that we kept telling him was, this was when the H1N1 flu was happening. And so everybody was trying to, even that time, talk about hand washing and masks. And we were trying to tell him, and he was also HIV positive. And, we kept trying to tell him, please wear a mask. At least everybody else is going to be safe. He was such a friendly person, laugh at us. No, how will I breathe if I wear a mask? Ha, 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 but never wore a mask. So thankfully, that situation we have crossed. Cough, whenever we used to speak about cough hygiene, it was predominantly for patients who were having cough. And there, we used to encourage wearing of mask. And then, whenever you're sneezing or coughing, into the elbow. And also whenever you're spitting out, because there's a lot of phlegm in patients who have lung TB, spit it out into either into the cups or into the, currently we are encouraging them to just spit into the toilet and flush it quickly. So some of these things were actually encouraged. But then I have to say that this is on a very individual level. Now, I speak to one patient as a doctor. The health worker speaks to another patient as a doctor. It is not in the form of the mass movement which you are talking about, which I think makes everybody's lives easier. Now everyone is wearing a mask. Now I can imagine that guy wouldn't have laughed at us at all. So the mass movement is what is important.
Another, I think, a very important point that Dr. Prarthana's discussion brought up is to understand that being infected with TB and having tuberculosis as a disease are two different concepts. That needs to be very well. So almost 1/3 of the world population is infected with TB, but not everybody has the disease. So that disease really comes up, when our immune system takes a hit. So that is a concept that really needs to be understood. So even if I'm not showing symptoms today, but I might be infected, and there might be a time in future that, if I have a comorbidity, or if I have an immune suppression of some sorts, that, I do show symptoms of the disease of tuberculosis. And I think another, since we are comparing COVID and tuberculosis, one, of course, a beautiful point was brought out that the symptoms of COVID, they come almost immediately. Another very important point to understand is that COVID is different from almost anything else that we have seen. The reason being, it was an absolutely unknown menace, and you just see people falling and dying, like flies. You did not know what you're dealing with. You did not know the nature of the virus. The sequencing of the virus wasn't known. So, as humans, we tend to become very complacent with things that we know, even if they have a much higher, death rate, or much higher sensitivity, much higher severity. But as far as COVID went, because we always fear what is unknown, Yeah, so that is one factor that I think definitely we need to consider.
Coming back to Odette, the spitting as an habit in countries is tolerated for generations. And I think you have done a survey of seeing that what makes people to spit. Just give some idea about it, what you found out in that.
So largely the reasons are, first of all, lack of awareness that it even spreads disease. What's wrong with it? People have done it all the time. There are a lot of people who spit to give emotions, frustration, disrespect, anger. In the movies you see, when, it's a scene of, recently somebody named 2 movies where the heroes spit. I'm saying, if our heroes are spitting, the Bollywood heroes, people think this is something good to do. So one of the things I want to do is have a disclaimer, like whenever the person spits, you say smoking is injurious to health. We need them to start doing it for spitting as well. On the paan packet, like you have for don't drink and drive, we want on the paan packet, don't chew and spit, because these people chew and immediately they spit. So the paan is chewing is one of the hugest reasons for spitting. There may be few cases who spit genuinely because of congestion in the throat, phlegm, but there is a right place and a wrong place to spit. To such people, we are saying spit only in a wash basin, or keep a tissue or a paper, spit into it, put it in the dustbin, or worst case, carry a personal spittoon. On Amazon, they are selling spittoons for 200 rupees. Incidentally, there is a new company which has started this spit pouch. This video went viral a while back. It is 5 rupees per pouch. Who is the man on the street going to spend money on this? This may help in trains, or the people who, there is that group of people who spit out of fancy cars, I'm told. For those people, this can help. But for the large majority of people who spit, we are also asking them to carry this. In fact, doctor, one of the suggestions is for TB patients, you all give kits to them, right? Along with the medicines. Why can't something like this be included? Because it will make them realize spitting anywhere and everywhere is not okay. And if before COVID they did it, now I think it's much easier to reinforce that no, spitting cannot continue. It's everywhere and everywhere. And one of the last reasons for spitting, of course, physical conditions like dust. Construction workers, since you mentioned, they spit a lot. They're having dust all the time. Garbage workers, they're dealing with garbage. I'm told people, when they see a carcass, because of superstition, a lot of them spit. Some people, many of these things I have picked up during webinars. Students told me, I'm a Christian, I didn't know this. One student told me, my Christian friend spits every time somebody mentions the word devil. So that is just a superstition. It's not a religious thing. People bring up spitting during Ramzan, and from Muslims themselves, They have confirmed that nowhere in the Quran does it says you cannot swallow your own saliva during Ramzan. So these are misconceptions. And by walking on the street and talking to people, the biggest eye-opener for me, the largest reason that people spit is they believe that saliva is waste from the body like urine or excreta. So when I ask them that, when I tell them don't spit, fir kahan thukna hai? I say, but why do you need to spit? Why don't you swallow? They say, chhi, itna ganda, how do I take it in? Now, the fact, I think from the Dr. Kunal last time, and he can add on, the fact that saliva is beneficial to the human body is something which is very powerful. Dr. Kunal has promised me to give me a video on this. And I want every doctor in every state, Accha, you're in Mumbai now, you can give me Marathi also. In regional languages, we want doctors to give us
coming to Bangalore.
videos.
I'll be there for 4 days.
These videos, we can, just have them on our phone. And the minute and a guy says, then where do I spit? Accha, listen to this doctor. For Karnataka, I have Puneet Rajkumar's video appeal, which he gave us in June 2020. When I tell a person on the street not to spit, now I don't tell them that. I said, no, Dipa, or Nimsha Nodi, and I share it. And they listen and they say sorry. So yes, people spit because they think saliva is waste, a large group of them, and that's where awareness will come in. So
I would, taking on this spittoons and this box and all those things, what you would feel, Dr. Kunal, do you subscribe to it? Do you see that there is a usefulness in that? Or
no.
Go ahead.
The idea of, paper cups or, these boxes, but spittoons is something that you need to take, treat with caution, because they actually, in a reflux subconscious way, they actually, encourage spitting, which could be dangerous. So, this needs to be taken with, you need to treat with caution. The other thing is, for those who have a mentality saying that it's waste and it should be thrown out, out of the body, we should also ask them that whatever else that they consider waste, which is urine or feces, do they just keep spreading it out on roads, in public places? So if even if it is waste, this is not the way that it needs to be disposed of, So of course it is not waste. I mean, your digestion starts from the saliva itself, and then there are definitely other benefits which I can go on and on about, but that's for Odette's video. We'll keep that confidential, but definitely these are very deep-rooted mindsets that need to be changed.
So I think one of the questions which I would like to take it from is Dr. Prarthana, that you have, if you say about 19,000 patients are there who are identified as TB and they are going through treatment and all, they are going to be the ones who are significantly going to matter if they start spitting and all those things. All three of you, the panelists, I would request you to think how they could be, kind of motivated not to spit. If given a chance to take a small program along with Odette, what would be your suggestion? I'll start with Prarthana because she knows those, 90,000 patients. At least she would have worked with them.
So like Jayaraman sir, like Dr. Kunal mentioned, not all these patients would have cough. Lots of them will have non-lung TB, which means that they do not have cough and they are not actually capable of spreading the disease at all. So they will be having it in somewhere in the abdomen or somewhere, some kind of swollen glands in the neck or sometimes in the brain or etc. But they're not capable of spreading the disease. Only say 50% of them, 45 to 50% of them who actually have lung disease will start are coughing, and so the whatever aerosols come out, whatever droplets come out when they cough, sneeze, speak loudly or spit, only that they are capable of spreading the disease. That is the first thing. And how they can be useful? One, on an individual level, currently I can say that almost everybody is counseled on cough hygiene to a large extent by the national program, by innumerable number of health staff who are working with them, including NGOs like ours, the government sector and everyone else. That is the first thing. And there is a concept within the national program of something called as TB champions, someone who has actually completed their treatment and someone who can be a motivation for others who are still undergoing treatment. So that group of people are also people who are ready to talk about their experiences to others. They can be very good resources who can actually, currently they speak a lot about side effects. You will get side effects, but don't quit your medicines. But there are also people who are very resourceful when it comes to spreading out and giving out these messages. Now, I will always listen to someone who has gone through the same experiences like me. I mean, like madam, you said you had pleurisy. So if I am going to tell you it's okay, you control your pain and you control your breathing and things like that, you would not be listening to me. But then there's another person who has gone through the same thing, that the connect is much better. So utilizing the TB champions for these kind of campaigns would be actually very, very beneficial. And I think the impact might be greater for patients who are actually having this.
Excellent idea. I'll connect with you on that, because we can get them to do videos. Right now, what I want to create resources which can just roll out through phones and WhatsApp, so that more and more people, the people ask me, I don't like spitting, but how can I explain to somebody? So if you have a video that you can show a short 1 minute, 2 minute, I think that would be very powerful. And one more thing, doctor, if it is possible to make all of them realize, I know spitting hasn't been given focus even from the TB prevention. And I was very happy to see that no spitting image in this year's World TB Day poster. But as you yourself sitting in Delhi are saying that it's not yet really implemented. It's going on for a few days, right? Or is it over? Can you please make a noise about spitting on our behalf?
No. See, the thing is, it's always the people who are working, the service delivery people, people like who are actually the program managers, the doctors, the healthcare workers, they keep talking about it. What I mean to say is the focus is more on treatment, because the belief is the moment you start treatment, the infectivity comes down drastically. So let us at least give treatment. Let us at least start that. That is the main thing. So spitting becomes a part of cough hygiene. So when you're coughing, do it like this. There are 4 different things that we say, and it becomes a part of that. But what I'm more concerned about, and where I see a movement like yours helping in this, like how mask became such a commonplace for all of us. If it comes as a mass movement, it comes as a hygiene kind of a thing, rather than just as, you have TB, so don't spit. It becomes much more acceptable and more impactful. This we are doing it for an individual, one patient kind of a thing. Whereas when you do it the way you are doing it, spitting as a no spitting across, whether you have TB, whether you don't have TB, you have COVID, you don't have COVID, you have pneumonia, you don't have pneumonia, you are a smoker, you're a tobacco user, whatever it might be, no spitting. That has a large impact, is what I personally feel.
But you are saying that spitting is treated as part of cough etiquette. I would suggest clear pictures for both. It should be in every TB center, PHC and all of those. So that's one follow-up which I'm planning to do. And through Rotary, we can roll out the stickers.
Okay, Kunal was trying to say something. Yeah.
Sorry.
No, I think a very pertinent point was raised by Dr. Prarthana. You see, the devil has to be addressed in its detail. The point is that you actually need to go down to the behavioral aspect of every individual to change that. I'll tell you an example of what kind of a difference it makes. You see, when COVID came, Japan was a country which was probably one of the least affected, especially in the first wave. The reason being, the general hygiene practices in the country are so phenomenal. I've had the good fortune of visiting the country. And if you see that, a lot of people genuinely, they wear masks. Whenever they'll cough, they'll usually use a tissue paper or something else. These are the things that you really need to focus on. I mean, not every disease can be contained, based on treatment. Early detection, prevention and early detection is definitely going to go a long way, especially in cases of multi-drug resistant, because these are the cases which are very sinister. They cause high fatality and they are detected very, very late.
Yeah, I think now we are coming into the end space of it. We have been having a wonderful discussion. I would like the panelists to make their final comments from their angle. What is that TB and spitting? How it could be addressed to? Maybe one question with Dr. Kunal is the medical fraternity is kind of sensitized about it, and they do talk about, these kind of things with the TB patients or general patients itself. This spitting is not a useful thing.
Of course, it's always a part of the discussion, especially knowing that an Indian patient is more likely to do this. So we definitely talk about it. And also it's important to understand that, there are a lot of detailed practices which are told to patients, because the way a patient has to be, it has to be a two-way process. There have the people who are in close proximity to the patients also have to take care of not being vulnerable to infection. The patient himself or herself have to, take care that they don't do activities which cause other people to, get infected. So, I mean, not going to public places, not spitting in public, those are things that we talk to every patient.
What we will do is we'll roll down one small TB film, which Kashinath will roll. After that, I would like you to, make your concluding comments. And then
Jairam, before that, if you don't mind, I have a team from Pune who are currently traveling in, I think, Dehradun. They are on the road and they have come in. So if you don't mind, can I give them a minute or two to, they have been working. This is Preeti and Raja Narsimhan from Pune, Sare, Jahan se Accha.
Right.
Hi, Preeti, Raja. They have been driving around the country to spread the message of no spitting. So I sit in my room and try to reach out to the world. They are going out across the country. They had also come to Bangalore. So I would just like them to add in a minute, if they can, anything specifically relevant to TB, and if you have tuned in anything to add on. Yes, Raja.
Thank you, Odette. And thank you. And yeah, you're right. We are currently in Dehradun, and it's been almost 20 states that we have covered with 20,000 kilometers. And that's a great feeling. And today we met the mayor of Dehradun, and he was kind enough to spare 10 minutes to do the flag off. And when he heard that, we have come all the way from Maharashtra, he was thrilled. And he said, you're doing a fantastic job, and more people like you need to join the movement. And when we told him that, it's a new dimension that we are giving to this entire spitting culture, is very simple. The mindset change is required, not with the people who are spitting, but people like us who need to wake up and tell those people who are spitting, please don't do it. So he was pretty thrilled with this message, and that was in Hindi. Na thukenge, na thukne denge. That's a message we gave him. And it was a great 10-15 minute conversation with him. And as you said, we have been driving all over India. Before this, we finished Shimla. Then prior to that, Chandigarh. Then New Delhi, we had 5-day hectic campaign. And next we go to Kashipur, then Lucknow, then Agra, then Gwalior, Indore, Nasik, and Pune back. So we return on 10th April. Everywhere.
So I think we'll have to wish you all the best, because we have just 1 minute left and we still have a couple of questions. Thanks for joining in and keeping the flag for no spitting high.
Thank you, Raja.
Yes, thank you. And if you have not seen the car, this is the car.
Yes.
Yes.
We have seen it in Bangalore.
Good to see you. This is Kashi. Yeah. Good to see you.
Kashi.
Thank you.
Yes.
Yeah.
Yes, you can carry on now.
Yeah. So
have a safe trip. Have a safe trip.
So I think I will share the video.
Videos, and then we'll close it if there is any comment.
So just before that, I have one question. Just one question, maybe for the panelists, or maybe mostly from Prarthana ma'am. So from Rotary perspective, how can Rotary Club can come and because we are always trying to do a lot of camps and screening and all that stuff. But I'm a little puzzled now, because probably maybe effectiveness is not there in terms of this. So that's what I just wanted to see how we can, as a Rotary Club, can come in picture.
Kashi, I have to answer on behalf of Prarthana, if she will allow me. She has sent me a nice project note.
Okay.
If you see that, she has covered everything. It is from awareness of TB to end point of it, where we can do the support for diagnostic. Don't worry.
Yeah.
We are now taking it up. Now we have asked the question, Prarthana. Me and Kashinath will take it up.
Good to know that.
Excellent. I will send it to you tomorrow after this meeting is over. I'll send you the project.
And the second question is just general. Second question. We usually do this health checkup, right? We usually do annual health checkup. At least we go when we family go and do health checkup routine annual. So now in that also you feel you don't get a symptom of this thing. Don't you get this kind of clue that that there is a TB or something like that? Or are we missing something there?
There is a 4-symptom screening, which Dr. Kunal already mentioned, which is what we generally use in most of the camps, and only in very vulnerable population like those who are in mining or something like that, X-ray is advised, chest X-ray. But otherwise, the 4-symptom screening is enough. And if any of the symptoms are present, then we can actually, subject them to further testing. So, I mean, if anytime that we get on a call later, I can actually give those 4-symptom screenings, and then we can see.
Okay, thank you. Thank you. So let me share my desktop.
After that, also while he's sharing it, Mr. Narayana from Swaasa, maybe you want to just tell us about that tool. Accha, he's already got it on.
An estimated 1/3 of the world's population is infected with tuberculosis. 1/3. And here's the culprit, the minuscule bacterium called Mycobacterium tuberculosis. But does that mean 2.3 billion people are sick? Fortunately not. Only a small proportion of them actually become sick. To understand why, let's take a closer look at the bacterium itself. When someone with TB coughs, they expel little drops of saliva that fly into the air. Some of them may contain the TB mycobacteria, which can then be inhaled by someone close by. Mycobacteria then continue their journey down the respiratory tract and into the lungs. That person is then infected with TB. And this is where it all becomes a little more complicated. The body detects the invasion and sends out its first line of defense. This includes special cells called macrophages, which engulf the mycobacteria and transport them to the lymph nodes, where they are neutralized. If they're neutralized, the person will have what is called latent tuberculosis. This means they're infected with the bacterium, but they don't have active TB disease, and they're not sick. However, in 5% of cases, the immune system is overwhelmed. The TB mycobacteria multiply and escape, and the person falls ill. This often happens with young children, whose immune systems are not fully developed. In other cases, latent TB can wake up and become active TB. This can happen months later, or even years later, especially in adults with weak immune systems. For example, people who are HIV positive, or who've had organ transplants, or who are undergoing chemotherapy. Once in the lungs, the bacteria may spread via the bloodstream or the lymphatic system to other parts of the body, to the lymph nodes, bones and joints, the digestive system, the central nervous system, the liver, or the heart. So what happens when someone has active TB? Let's imagine the infections in the lungs, as this is the most commonplace. The patient starts coughing, has difficulty breathing, and suffers from chest pains. If these symptoms last for more than a few weeks and are accompanied by fever, night sweats, and weight loss, the doctor has good reason to suspect tuberculosis. The next stage is diagnosis, and then treatment. The battle is far from over.
Yeah, that's the end of the video there.
Odette, you have that gentleman, or we can close
Yes,
it?
I can see Narayana Rao, he's there.
Yeah,
I
I'm
think
here.
we can.
I'm here.
Yeah.
Please
Good
make
evening,
it
everyone.
quick.
Yeah, sure. Good evening, everyone. I'm Narayan Rao. I'm the founder of a company called Salsit Technologies. So we have a product called Swaasa. Essentially, it is primarily used for screening pulmonary tuberculosis. We use cough sounds and a set of symptoms, and then apply it through the artificial intelligence to identify whether there is any likely presence of a tuberculosis. Primarily, this is helped in detecting basically if we identify the person has likely presence of tuberculosis, then further investigation can be done. So prioritizing the diagnostics, who has to go for diagnostics is really where the tool is useful. And of course, the advantage is the scalability. I mean, we can really do screening in a mass volumes. That's basically the advantage what we have. We have recently completed clinical validation at Andhra Medical College, and we are looking for partnerships in really pilot testing and deploying it through various community health centers and public health centers. So
So
Dr.
where
Kunal,
I have reached out to him is, of course, he can reach, network with all the diagnostics, but put no spitting signs at all of these. So that's my interest in
of
making
course,
sure we remind them.
of course, we do record the cough with the etiquette. I mean, we will not do in the public. Basically, the person has to wear the mask and in an isolated place where we do the recording.
Great. Thanks a lot, Narayana.
Thank you.
You please post your number there in the chat box so that others can also.
Sure. Sure.
Please. Thank
Definitely.
you. Thank you. Thank you.
Kashi, I warmly thank everyone for that wonderful, participation to all the three panelists. Now you can officially formally do the vote of thanks.
Yeah. So I think it's time for a formal vote of thanks. But I think we had a wonderful, informative session, and then we could get a lot of insight on what's happening. And you can see, I mean, you can hear from Dr. Kunal Sharma and Madam Dr. Prarthana ma'am, both coming from a different angle, and at the same time as a citizen group, Odette bringing her point of view, and from a Rotary angle. If you all four of them can join hands now in that sense, right? And then, of course, there is a lot of things to do, and I would like to really thank all the panelists for sparing their time. We had a wonderful session. Also would like to thank all the people who could join through online to us. Thanks for your participation. And I think this could World TB Day being a day where we could join, meet and have this discussion. But I think we will going forward. I think we probably will take it up in more serious manner. And Rotary being an integral part where disease prevention is one of the focus area. And on behalf of Rotary Bangalore Lakeside, happy to partner with Odette ma'am and Jayaraman sir. Would like to thank our club member who could join, and all the doctors and people, friends and well-wishers who could join today. Thanks for a wonderful session, very informative. Looking forward to work with you all in coming days. Thank you. Thank you.
Thank you, Kasi, especially for hosting this, because whenever I talk about spitting, I know you always say yes.
Yeah.
To support this. All those who attended, it would be really great if you've come here because you believe the subject of spitting is important, to stay connected with us. I put my number there, but if you can also just, the simplest way to connect is, remember, StopIndiaSpitting@gmail.com. So please stay in touch, because if you attended today and you think, these mad people are actually talking some sense, we'd like to spread some of that madness to more people so that more people get involved and stop India spitting.
Wonderful.
Thank you so much.
Good night to all. Thank you.
Thank you. Good night.
Thank you, everyone.
Thank you, doctors.
Thank
Yeah,
you, Dr.
Mr.
Kunal.
Jairam, Kasi.
Yeah.
Thank you, everyone.
Yeah. Thanks, Prarthana ma'am.
You
Good
can
night.
save the chat also, Kasi.
Yeah. Let me see. Yeah.
All right.
That's
All right.
great. We'll put this on YouTube as well, and I'll share the link.
Sure.
Sure. Thank you so much.
This goes on our Stop India Spitting resources. So down the years, people will watch it.
Right.
It wasn't just one-off. Yeah.
Wonderful.
Thank you. Yeah.
Thank you and good night.
Thank you.
Good night.
Good night to everyone. Thank you.
Thank you.